Just wake up.
Here is my audience of 7. All right.
My name's Megan Jones, and this is my speech, Legalize It. Why does the legality of a substance constitute the health benefits? Cigarettes are legal, but does that make them healthy? As stated in the documentary Culture High, the number of deaths due to cigarettes around the world is 5.5 million annually. That's as many people that were killed in the German and Jewish genocide. That means we're having a Holocaust every year due to cigarettes. Dr. Jocelyn Elders, former U.S. Surgeon General, wrote that the evidence is overwhelming that marijuana can relieve certain types of pain, nausea, vomiting, and other symptoms caused by such illnesses as MS, cancer, and AIDS, or by the drugs prescribed to treat them. And it can do this with remarkable safety. Indeed, marijuana is less toxic than many of the other drugs physicians prescribe every day. The American College of Physicians urges review that the status of marijuana be changed from a Schedule I drug and that its reclassification into a more appropriate schedule, proving that it does indeed have medical benefits. Unlike many of the drugs we prescribe today, marijuana has never been proven to cause a fatal overdose. Research on AIDS patients has debunked the claim that it harms the immune system. A study in San Francisco General Hospital showed that AIDS patients using medical marijuana gained immune system cells and kept their virus under control, compared to the patients that received the placebo. California finds that medical marijuana patients agree, 92% said that medical marijuana alleviated their symptoms of their serious medical conditions, including chronic pain, arthritis, migraines, and cancer. In the U.S., there are over 580,000 deaths from cancer every year, 29,000 alcohol-induced deaths, 17,000 deaths combined from illicit drugs, and 0 deaths from marijuana have ever been reported. As the New York Times posted, prohibition has enormous social costs. The effects of prohibition run from wasted resources to ruined lives. Our police devote thousands of hours to arresting, booking, and imprisoning marijuana smokers, many of whom are otherwise law-abiding citizens. Legalization won't increase use. There is a reason for people who oppose the use of marijuana to support the legalization. Legal substances can be controlled in ways legal ones can't. It is the illegal market with no standards, regulation, or price controls that can impose a menace to public health. Our current federal laws, which treat cannabis as equivalent to cocaine and heroin, are what teaching people that the government is completely unrealistic on matters of drug policy. Legalization is the first step in a broader initiative of treating cannabis use as a public health issue. Since legalizing marijuana in Colorado, criminal marijuana possession charges are down nearly 80% in 2012. Revenue derived from marijuana sales, licenses, and fees totaled over $9 million just in the month of March in 2015. Incidences of violent crime in Denver fell more than 10% following the opening of the marijuana business in 2014. The percentage of high schoolers who reported consuming marijuana within the past 30 days fell from 22% to 20% in 2013. An assessment of roadway fatalities in the first 7 months of 2014 reported a decline in fatal traffic accidents compared to the first 7 months of the prior year, and a decline in the state's 13-year average. Medical marijuana needs to be legalized not only on a state level, but on a federal level for a multitude of reasons, including revenue, crime, the ecosystem, but most importantly, the well-being and health of our fellow citizens.